Welcome and thank you for joining the NEHA National Webinar Series. Today we are going to discuss exposure sources for children who have found lead in their blood and the identification of lead-contaminated cinnamon in applesauce and apple puree products. I'm Criss Chief Learning Officer at NEHA, and I will be your moderator today. Our presenters today include, in no particular order, M.L. Tanner. M.L. is the Program Manager for South Carolina Childhood Lead Poisoning Prevention Program. She received her B.S. in Biology from the University of the South, Sewanee, Tennessee. She has been an EPA-certified lead risk assessor since 1999 and serves as the NEHA Regional Vice President for Region 7. Dr. Perry Rucker. Dr. Rucker received her Master's of Public Health in Epidemiology from Emory University and her Doctorate of Public Health from the University of Georgia. She has been with the CDC for 25 years. Currently, she is the team lead for the Strategic Partnerships and Policy Team in Lead Poisoning Prevention and Surveillance Branch in the National Center for Environmental Health. Perry has authored over 30 publications in the field of environmental public health. Alan Honeycutt. Alan has 25 years experience with children's environmental health as a regional EHS in childhood lead poisoning prevention. He received his BA in psychology from North Carolina State and his Master's of Public Health from UNCCH. He also worked part-time for 29 years in logistics for the Federal National Disaster Medical System. And Michelle Howard. After working in retail food for over 20 years, Michelle has served with the Federal Department of Agriculture since 2016. She is currently in the role of state liaison, which means she is the primary contact for the FDA-related questions and inquiries. We ask that you please write your questions into the chat box and not the Q&A tab. By doing so, all attendees will be able to view the questions asked, and we will address them at the end of this presentation. If you are not a NEHA member and you enjoy this session, we invite you to become one at neha.org. So right now, we are going to begin with Alan. So Alan, would you like to start your presentation?
Sure, thank you. I'm going to go ahead and share my screen here. And there we go. And did that pop up? Hopefully my PowerPoint has popped up here.
It is, Alan. We can see it. But we can also see the small ones down the side. If you want to put it on presentation format.
Okay, sure.
It'll fill the full screen.
Okay, thank you. And let me see here. And slideshow, here we go. Sorry about that. Let's see here. Well, normally here we go, slideshow. And so you can still see the sides. Sorry about that.
Yeah, it's okay if you just want to move forward.
Sure,
with all of us as well.
Okay, yeah, so I'm sure there's a way to get rid of that. All righty, I got the slideshow going. Okay, well, my name's Alan Honeycutt, and I don't know if you can. This is the I don't know if you can see it. This is the Wanabana applesauce that sort of started the problem. It comes in a little pack. I hear that kids love it, and that's you can't buy it in the stores anymore. But thank goodness they have taken it off the shelves. You used to get it at the Dollar Tree, and it's no longer available. So I know my caseload has dropped down. But what I'm going to describe in about 10 minutes or so is just the beginning of the investigation. And so normally in North Carolina, we we get a call from a local health department when there's a child that has either an elevated blood lead level or has a confirmed lead poisoning level. And in North Carolina, the elevated blood lead level is from 5 to 9.9 micrograms per deciliter, and there has to be two of the two consecutive blood lead levels at that level, and that we'll go out. Everything is voluntary. We'll go out and do an investigation, or if there's two blood lead levels of 10.0 micrograms per deciliter, two consecutive within a 12-month period, that is confirmed lead poisoning, and we will go out and we are required to do an investigation, and and also the property owner is required to remediate the lead hazards. So this is the what happened in this particular instance. The child, we had two siblings, and I got a call from one of my coworkers in due to HIPAA regulations. From what I understand, I cannot mention the county. I cannot mention my coworker who I worked with. That's just according to what our attorneys have told us. Can't mention the exact dates that we did an investigation, and can't mention the blood levels, but I can sort of we can go sort of work around that, I guess. But so what happened? There were three households. And so I'm going to start off here with household A, a lead investigation. And there was a 3-year-old and a 1-year-old child in Western North Carolina County with blood lead levels above 10 micrograms per deciliter. This was in June 2023. And we conducted a lead investigation in the household, and that was in early July 2023. So what normally happens, the local environmental health specialist will get a notification, and they will contact me and ask me to come out. I have a X-ray fluorescence analyzer. I don't know if you can see that, but that's what one looks like, and it has a source. This one has a cadmium source, I believe. And so we go out and we look for lead-based paint. And so during the investigation, what normally happens is that we go out and first start with a questionnaire asking the parents, what do the children eat, where do they play, and we do have that on our website. You can go to just put into Google Children's Environmental Health, and you can bring up our website with all of our forms, our SPICE forms and different forms. And so, but that's how we got started. And we went out to the house to do the investigation. And basically, on the questionnaire, normally I'm warming up my XRF, and the parents advised that the two siblings, they played in dirt. They did, like all kids, they put their fingers in the mouth, they chew on toys. They did not, chew any paint, woodwork, or furniture. And the family didn't burn any battery casings on site. We sometimes run into that. And neither of the parents' hobbies or work led to any exposure. And so during this investigation in household A, the children did not play or wear with any brass objects. Imported herbs or spices were not used as supplements or medicines, and there were no cooking or ceremonial activities, such as sometimes in certain families, azarkan is used as a folk remedy, or they may use certain types of ceremonial activities that we do run into, and often very high in lead. The children didn't have any access to vinyl mini blinds. We don't see that quite as much anymore. So So, vinyl mini blinds wasn't wasn't the source. And the food there was no food that was prepared or served or stored in ceramic ware. Oftentimes we have bean pots and things that can be a problem. Okay, and we using the XRF fluorescence analyzer that I showed you, 115 surfaces were tested for lead-based paint. A few of the exterior and interior surfaces did test positive for lead-based paint, but most of the surfaces were relatively intact in this 1950s home. So generally, you're not going to find any lead-based paint in homes built after 1978. Okay. And we took 6 dust samples. Dust samples were taken from the porch floor, a carpet rug at the front door, floor below. There was like a religious shrine and incense. We did sample some incense dust, father's work shoes. They were all below the laboratory detection limit of 5 micrograms per square foot. So no real samples. Nothing came back high as far as the dust. And we did take a composite front yard soil sample that was at 16 parts per billion. That's well below the hazard level of 400 parts per million. So that's what we consider a hazard level. I believe that's the EPA level and North Carolina level. A soil sample was taken from a container play sand, and those results came back at 15 parts per million. The sample of the incense ash and the sage did not result in any detected lead. And we also sampled a toy ink stamp. First draw water sample from the kitchen did not detect any lead. It was less than 3 parts per billion. We consider 10 parts in our program, 10 parts per billion is considered a hazard. And we're still on household A. An environmental lead investigation was conducted the next day at the Siblings Child Care Center, and there was no source of lead-based paint, soil, water, or dust hazards that were found at the Child Care Center. So the parents are very concerned. We went out to the Child Care Center the next day, and nothing, did a pretty good investigation there. Nothing came back high. And we sent all the sample results in. So all the sample results, like I say, there was no lead hazards. We advised the parents that the only thing that we found was lead-based paint in the basement. There was a basement door and a couple of little areas of lead-based paint that we had tested that did come back high. And so I got a call, and my coworker called the parents, advised them of that. And the mother told my coworker that we had not found the source yet, that she did not believe that the lead-based paint on the basement was the problem. And so what we did, we advised the parents to have blood samples taken and keep a food log for a week. And so, because we figured that it was probably something everybody was eating. That's what we figured. And so the parents' blood lead levels did not come back high. And while they were keeping a food log, the mother remembered that the children often ate the packs of applesauce from Ecuador. We went out and sampled those. The environmental health specialist went out and collected those samples, and also sampled from an outside water hose and from the faucets. And while we were waiting, the local environmental health specialist went out to that household A and took some of this, one of these apple cinnamon packs, also had another flavor, and sampled that, sent it to the lab. And while this was going on, I had another investigation in a neighboring county. and the blood lead level from that child was also above 10 micrograms, and that was conducted in mid-August. We got a little bit of lead on the floor, but not much. And but the mom brought out a pack of this. She said, "Will you please sample that?" So she gave it to us. We sent it off to the lab. We did some dust wipes. The only thing we came back a little bit high was from a garage, but the children didn't go there very often. And so all of we did take some soil samples in the backyard play area, water samples, those came back high. This is from household B. And then we did the sample from some spices, turmeric and ground cumin came back, I think the 0.2 parts per million lead, paprika was 0.36. These results were below the FDA reportable level of 1.0 parts per million. We did advise the child mother not to use those spices. Any little bit of lead is not good. And like I say, we sent those off to the lab, and they came. I'm having a little trouble seeing my slide here, but it did come back at about, I think, 1.9 parts per million on both of the packs that were sent off. And this was an investigation that I did not do. My coworker Criss in the western part of North Carolina had another household, and this was a child that had a confirmed blood lead level between 5 and 9 micrograms, and she conducted an environmental investigation in mid-October of 2023. And I know she went out to the house, and I had told her my results had come back, and that the Wanabana applesauce cinnamon, it was what the cinnamon had, or the cinnamon brand, did come back high. So there was no lead in the mobile home, but she opened up the cabinets, and she said there was about 30 packs of this applesauce. And so that was household C. And let's see, hers, they had levels between 2.5 and 3 parts per million. So that's when, and I'm going to stop right here. My time is over, and I'm going to let the next speaker speak.
Thank you, Alan. That was very informative, and it's interesting to see each step that you take along the way to what to rule out to get to what is the source. So ML, do you want to take it from there? Oh, ML, you're on mute.
Of course I am. Oh, I'd be happy to go next. First, I'd like to give y'all a little background information about how the South Carolina Department of Health and Environmental Control is structured. We are a hybrid agency, so we've got public health functions, traditional environmental health, enforcement, legal, all in one state agency. And the employees who work in county health departments are DHEC employees. So it's easy for us to get word out all across the state if we need to. At the time of this incident, our lead risk assessors were in the same division as our food folks, and that came in really handy. We first learned about the contaminated apple cinnamon product because Ed Norman, who is the program manager for the North Carolina Childhood Lead Poisoning Prevention Program, had posted on LeadNet. I don't know if y'all are all familiar with LeadNet or not, but it's a great listserv. LeadNet and Healthy Homes Net have a lot of good information, and they're also a fantastic way for people all across the country, actually all around the world, to share information about what's going on and to share it quickly. So Ed posted over the weekend about the FDA public advisory that had been issued, and it was October 28th or 29th. And I am dedicated to my job, but I do not check LeadNet on the weekends. So the next week when I was in the office, I saw that and let all of our childhood lead poisoning prevention folks know about the advisory. And we did a little research, and the Wanabana brand was the only one of the three that was being sold in South Carolina. So we started notifying providers and parents to try to get information. And this notification took a three-pronged approach. When we have a result in our database that indicates a child has a high enough level of lead in their blood that it will initiate referral for case management by a nurse and for an environmental assessment, we always call the provider to make sure it was actually a venous test and to get as many phone numbers for the family as possible. We collect insurance information. We try to get names of parents and any demographic information that perhaps should have been reported with the lead result that wasn't. So in addition to the questions we normally ask providers, we started asking them if they were aware of the contamination in the cinnamon applesauce products. If they weren't, we provided them some education, and we also asked if they had spoken with the family about that as a potential source. Sometimes when we call the providers, they've already had an opportunity to talk to the family about the child's blood test result, and sometimes they have not. But it was our first way to get the word out and try to collect information. The second way that we addressed this was when a nurse was assigned to a child for case management, the nurse have questions that they go through with the families. So we added the question about the product to what they asked. If the family answered no, then they still provided information about it, so the family wouldn't mistakenly buy it if there were still products on the shelf. This was before the actual recall. And the third way we addressed this was for the environmental health staff, the risk assessors, to ask when they call the family to set up a time to do the environmental assessment of the home. They ask a lot of background questions to help us narrow down the sources. We want to know the age of the house and if anybody in the family works with lead and a whole host of other things. So they added the cinnamon applesauce product question to that list. And in a few instances, when the nurses and the risk assessors got to the homes for the visits, parents were able to show them what they had in their cabinets. You know, my child eats this brand, is it safe? And that sort of thing. We did have one family provide us with an empty pouch, which we were not able to test. One family provided us with a photograph of the recall product, but they had gotten rid of it before we got to the home, so there was no product available for testing. And one family did provide a pouch, which we tested, but that was later on in the process. So in mid-November, once the recall had been issued, FDA and CDC had gotten involved. CDC sent out a health alert network notice. We were able to customize that. CDC provided all the technical information and, you know, for more information, go here. That was really important for all the providers to have. But we wanted our providers in South Carolina to have a South Carolina point of contact. And our childhood lead poisoning prevention program has a toll-free number. So we were able to customize the health alert with our toll-free number and also with the web address if people just wanted to go to the website and look at some of our brochures and look up more information. And that was sent out electronically to providers across the state. It was posted on our website, and we made sure when we got calls on the toll-free number to ask, you know, is this about the recall? And ask folks how they had found out about it, because we wanted to know if our messaging was successful in reaching folks. While all of this was happening in the childhood lead poisoning prevention program, our food people were also involved. The environmental health specialists in the food program were busy with their efforts to prevent any additional exposure. Our rapid response team sent information to more than 20,000 food retailers across South Carolina, notifying them of the lead contamination in the product. They also personally visited the Dollar Tree stores, which were the only retailer in the state where the product was being sold. They alerted them to the issue, asked them to remove the product from the store shelves. And in a few instances, they found that there was still some product available even after the recall. Following the rapid response team's visit to the stores, they contacted our partners at the South Carolina Department of Agriculture. The excuse me, the Department of Agriculture deals with retail food distribution. And so they were able to sent the Dollar Tree distribution center, and they discovered that 157 cases of the product had been sent out to stores after the recall. So the Department of Ag was able to intervene, contact those stores, and get that distribution stopped so that we didn't have even more of the product going into the homes to put children at risk. In January, we had our first pouch that we could test. And it was the only source identified in the child's home. We went through much the same process that Alan described, taking dust samples, soil samples, water samples, using an X-ray fluorescence analyzer to test lead paint, asking the family questions. Mom had the pouch unopened. We don't still have ours like Alan does. We tested it, sent it to the food lab that we use here, and we were also requested by CDC to send a sample to them, and we complied. We were able to, we had enough left, and we're able to send it to CDC for them to test as well. The amount of lead that was in the product that we tested was 11 milligrams per kilogram. It was pretty high. Since the January case, we did another press release to let people know that we realized the recall happened in November. It's now January. Some of you may still have this product in your cabinet. You know, maybe the child visits their grandmother and grandmother didn't get the message. We also shared the information with Head Start centers and child care centers because many of them provide food and snacks for the children who visit. And we wanted to make sure that we weren't just reaching out to parents after the child had an elevated level of lead in their blood, but we were trying to be proactive and spread the word. The South Carolina Department of Agriculture in January, when we released our press release about the identified contaminant, published a really nice half-page article about the work that DHEC and Department of Ag were doing together. And their publication, the Market Bulletin, goes to farmers and producers statewide. So while we were reaching out to healthcare providers, childcare providers, Department of Ag was able to reach out to farmers, people at farmers markets and that sort of thing. So we were able to cover a fairly good portion of folks in the state who might have access to this product, might know about this product, or whose children might be at risk from eating this product. Since January, we've not had any more children that we have linked to this exposure. We are hopeful that there are no more pouches of it lurking in drawers, shelves, or cupboards, but we are continuing to ask the questions just to be sure. And none of this would have been possible if Alan and his bunch had not done all the hard work, the footwork for us to begin with. And I'm so grateful to North Carolina and to CDC and FDA for all the great information they have provided us and continue to provide.
Thank you for that, Emma. That is very interesting. So next we're going to hear from Dr. Ruckert, and it takes all of you. What I'm hearing is Alan did the research, Emma helped get the information out, work with CDC. CDC brings in and works with Federal Department of Agriculture. So Perry, tell us your involvement in this case.
Sure. Well, thank you. And thank you to the other presenters for kind of giving all that great background. So at CDC, we get RSS feeds from CPSC and FDA when there are recalls related to lead so that we can notify our funded childhood lead poisoning prevention programs, or the CLIPs, to support situational awareness and amplify the outreach. As most of you may know, we fund 62 state and local CLIPs to strengthen blood lead testing and reporting, surveillance, linking children to recommended follow-up services, and population-based interventions. So we knew about the recall from FDA through the RSS feed, and we first notified our funded CLIPs about the pouches on November 3rd, and then we sent a follow-up email on November 6th as 2 more brands were added. So it started with the Wanabana, and then Schnucks and Weiss applesauce pouches were also added. I just want to let everyone know that during this whole investigation, CDC was meeting regularly with FDA to share information. So as more information emerged, CDC informed partners via the Health Alert Network, the HAN Health Advisory on November 13th, and another one of the presenters talked about that. And we also shared information via the Epidemic Information Exchange, the EPIX, and that was on November 21st. And that communication provided information about the case reporting instructions and the case definition. Then during December 2023 to February 2024, CDC hosted 4 calls with state partners. The first was on December 1st, and that was to discuss our role in the recall, the national call for cases, our communication plans, and answer any questions about the case definition. And then on December 5th, we went live with our webpage that reported on the case counts and information related to the applesauce. And at that time, we only had 3 confirmed cases, 4 probable cases from 2 states. And I want to give you some background on how we came up with the case definition. CDC staff from LEAD, the NCH Health Studies section, and emergency management groups all were involved in formulating the case definition, and careful consideration was given to what would differentiate the confirmed versus probable versus suspect. And the main difference for the confirmed cases is that the applesauce consumption had to be the likely source of a venous blood level at or above 3.5 micrograms per deciliter after investigation ruled out other likely sources. And you heard about how the states went about doing that. And so that was really excellent. So within 2 weeks of announcing the call for cases, so this was in mid-December, we started with 3 confirmed and 4 probable, and we were already up to 205 cases from 33 states. Over half were probable, and that was just in the first 2 weeks. And then in December, we became aware of chromium contamination in the applesauce pouches. So we released a COCA now for clinicians. That's an outreach to clinicians. That was sent on January 5th. And we also did an updated EPIX for the public health professionals on January 17th to share information about the chromium. And then reports of cases were rapidly increasing in December and January, but as even though more cases were coming in, they were starting to slow down a bit in February. And then to try to figure out when we were going to end the call for cases, in February, we sought feedback from our 62 CLIPs. And we did this by asking them to give us some feedback on what is their current level of involvement in the investigation. Are they investigating cases retrospectively? This is because we were aware that the applesauce pouches were sold starting in November 2022. And so, of course, we were recommending, and the states were investigating the more recent cases, but if they had more resources and time, they could go back to when they were first sold in November 22. And we wanted to know if they had capacity to continue finding cases retrospectively. Did they plan to conduct any special studies or analyses, and what they needed from CDC to conduct their work more efficiently. So by March 22nd, there were reports of 519 cases from 44 states, DC and Puerto Rico. About 2/3 were probable. I also want to let you know about some other activities that were going on related to applesauce during this time. CDC responded to an inquiry from 16 members of Congress who urged us to broadly disseminate information on the issue and ensure that all families who are worried about potential lead exposure are able to get their children tested. We responded to numerous inquiries from state partners and the media to keep all interested parties informed. We've been responsive to several FOIAs, Freedom of Information Act requests related to this recall. And since we've been getting these line listing data from the states, we've been cleaning the data, examining the data, and working on a publication about the case counts. And we've been evaluating other potential analyses and publications. On March 28th, CDC hosted an after action discussion about our national call for cases. And the purpose of the call was to hear from impacted states on what worked well throughout the response and what can be improved upon. And the discussion themes centered around the epidemiologic investigation, communication, and collaboration and partnership. And so that was just the last few weeks. So we're in the process of generating a report so we can develop lessons learned and do things better in the future. We are going to end our call for cases this Friday, April 12th. And this date was chosen to allow enough time for states to become aware of new cases who were tested within 3 months of exposure. And this is per the case definition. And to get more information about the previously identified suspected or probable cases. And then once that is closed out, we will begin to finalize our numbers and make them available. Just want to let you know that funded CLIPs can still report cases related to the applesauce recall through routine surveillance. And just some limitations of the data that I want to point out, that the cases related to the applesauce recall are likely underreported because of a lack of testing, or it was unknown that the higher blood lead levels were due to the applesauce. Also, for our case counts, we're using the state categorization, whether it was confirmed, probable, or suspect. We're not doing any further confirmation. Also want to point out that FDA was getting information related to the applesauce recall, and it was from different data sources and counting some different things. So our numbers are not necessarily going to match the FDA complaints, and that's okay and expected. The FDA relies on self-reported information submitted by healthcare providers, consumers, and some state partners who would submit an adverse event report as an initial step in determining if there was a product that was the shared source of contamination. And as I mentioned, our CDC reports, the data were directly from the state health departments. So I just want to close by saying that this effort demonstrates a strong collaboration between the different parts of CDC, the FDA, and our state partners to help address an emerging issue. And so I want to thank you again for working with us. And that's all I have. Thank you.
Perry, thank you so much. It's really interesting watching this chain go through. So Michelle, you're up. Tell us about your role in the FDA.
Well, hi, everybody. So what happens is I get an email and it says, hey, we've got this report and can you get this lab information so that we can check it out? So I had to reach out to the North Carolina Department of Health and Human Services, which normally I may have limited contact with some of the people in that agency, as relates to outbreaks and things like that. But normally most of the communication and work that I do is with the North Carolina Department of Agriculture. So this is a whole new group of people I'm dealing with. I have to introduce myself and ask for all this information. I have to get it to our Office of Regulatory Science and our Center for Food Safety and Nutrition so that they can, analyze the data to see, if we can support their findings or, if we want to do further testing. And at the same time I'm doing this, I actually did reach out to my North Carolina Department of Agriculture folks to say, hey, you know, can you guys pick up some of this and test it and see what you get? So this was probably one of the best examples of all the agencies and state partners working together to get this information analyzed, reported, and coming together to do such great work to get this product off the market. But it happened very quickly. And within I'd say a little over a week, we were messaging, the consumer advisory. Let's get something out to the public. Let's get the public warned. And we would then start doing some more things, on the backside to try to see if we can figure out, was this an isolated incident? Is this something that is, in all the flavors of the products? And through all that testing and our folks going to the firm and that was identified as manufacturing the product, determined that there were 2 different brands that were also made by that firm. That's how we got the Weiss and the Schnucks in there. And, it doesn't always go this smoothly and it doesn't always go this quickly. Because we have RRT set up with all of our different state partners, I know somebody else mentioned their RRT, we were able to reach out to our RRT partners and to their labs to see if they could be doing additional testing as well. And once it was confirmed that everyone was getting very similar results on lead levels, we knew, without a doubt that this was, not, and it turned out not just a nationwide problem, but an international problem as well. So, we talk about an integrated food safety system all the time and how nobody can do it by themselves. And if it wasn't for the great work in North Carolina, identifying that product, none of this would have happened, or it might have happened later. And with these events, we want to prevent. That's our job, is to prevent these things from happening. So identifying it quickly, identifying the source, and then getting that product off the market, which in this case did kind of tend to be the problem, because we did have some problems with this recall. This recall did not go as smoothly as it should have. We did keep finding products on the market when it should have been recalled. So that is something that, talking about lessons learned, that's one of the things that we are doing moving forward is, we're trying to make sure that when we talk to firms about recalls and handling recalls, that we make sure they have really good plans for it so that this doesn't happen again. But yes, there was a lot of work behind the scenes and, a lot of different people involved. We had our core, our coordinated outbreak response and evaluation team working on this. We had our folks at CIFSAN, we had our folks in Office of Regulatory Science, we had our emergency response coordinators. I am a state liaison, and our job is to be the primary contact for the states, both the Department of Agriculture and the Department of Health, whenever they need assistance, to reach out to us. And there are state liaisons for all of their states. So if you don't know who your state liaison is, find out. We're there. We are there to provide any assistance, because I know that was another kind of little hiccup. A lot of the, retail food people didn't know how to fill out a form for the recall, audit checks and things like that. So we're working on integrating that more with people that we don't normally work with in the event something like this happens again, so that there's those just-in-time trainings and things like that. And they also know who to reach out to for help when they need it. I know I was at the RRT meeting in December, and I was still working with our states there because that's when we had another round of, we had another ask for our states to go out and look in the stores, because we kept finding product on the market, to figure out what was going on and why that was happening. And it turned out that the products got shipped to distribution centers, and the distribution centers didn't know this was the recalled product. They thought it was new product. So anyway, long story short, lessons learned. Yes, we have had hot washes now, both internally and with our state partners for lessons learned and things that we can do better next time. But, you know, our role was huge, as was CDC's role, as was our state partners' role. We all had a part. We played our parts well. And if it wasn't for the North Carolina folks finding that product, when they did, we could still be seeing kids being, subjected to this product. I know I worked lots of hours without any time off, and as did other people. And but again, as we talk about this integrated food safety system, and this is what we are supposed to do. We're supposed to work together, and this was a great example. And everybody deserves kudos in this. Moving forward, we did have the chromium finding, yes, and it has turned out that the cinnamon was contaminated intentionally. And, that's something that is unfortunate. There are people out there that are bad actors, and, it's an economic adulteration. But, that's things that we learn each time, and we can put, safety measures in place to make sure these things don't happen again. And that's what we want to do. We want to learn from each thing so that we don't have the same thing happen again.
Excellent, thank you. Now I'd like to join our panelists back. We have a couple questions that I would like to throw out, and anyone can answer them, please. So one of the questions that we received was, did North Carolina do any retrospective case finding, and what was their process?
I believe they are our data folks. They are looking back, and I'm thinking they're trying. I can't think of the definition. That's sort of left up to we have our data folks who are looking. I think they're going back a certain number of months, but I am not. I'm not directing that, so unfortunately, I can't speak too much of that. But they are looking back to try to figure out if possibly some of our cases, when we go out and look, we don't find anything. That can happen. We go out, we do an investigation, nothing pops up. So I think they're looking at some of those cases where no source was found, and but I can't speak too much to the exact process on that. But I know our data folks are looking into that. Wish I could be a little more help on that.
Okay, thank you. We just had a question come in that I was going to ask anyway. I thought it was so interesting, Michelle. How did you find that it was intentionally altered, or it was an intentional situation and it was altered?
So our scientists know this stuff. So we test all kinds of products all the time. And they come up with these, baseline levels of what's in a product naturally or normally, because as cinnamon is ground, the equipment that is used, sometimes things get imparted into that. But with the level, the measurement, the actual milligrams of the lead that were in that product, that was just so astronomically high that it could not have been something that was natural.
And was it for economic gain that maybe the cinnamon would go further and they could use minimal amounts?
Yes, ma'am.
Okay.
Yes.
That makes sense. We have another question, Alan, that I think you may be able to answer. And it said, what was your process for testing at child care centers? Have you experienced any refusal of testing at child care centers? And are there any requirements for them to address the issue?
Yes. So in North Carolina, our law basically states that when we go out and do investigation, the 5 to 9.9s, those are considered elevated blood lead levels. So that is a voluntary investigation. So we will go to normally just to the primary residence, um, and do our environmental investigation there. Every now and then, we might go to a grandparent's house, another location, if we don't find anything at the primary location. But our rules basically state that it's all voluntary. We do not require remediation. Now, in this particular case, there were 2 children who the 2 siblings had above 10s. So they were considered a confirmed lead poisoning. And so in that particular instance, we are required to go out and do an investigation. We also look at, we consider the rule is places frequently visited. So it could be a grandparent's house, it could be a child care. And we look in our definition, I guess maybe it's EPA, I'm not sure, but I know it's in our North Carolina law. If the children visit a location at least twice a week, at least 3 hours on each visit, and at least 60 hours a year, then that is considered a frequently visited location. And we are required to go out and also investigate that location, like say whether it's a parent's house, whether it's a child care, a grandparent's house, a child care center. So that's covered under our North Carolina law. And so we are required to go out and do an investigation, in this case at the child care center. And any lead hazards that we do find under our North Carolina law, we can require that they be remediated. So that is a requirement that they remediate them. And often that doesn't happen very often. More than often, we can get a referral from our North Carolina Department of Child Development and Early Education. When their inspectors go out to a child care, if they notice what looks like lead-based paint, they can make a referral and we will go out and do an investigation. Or if someone from a local health department, our local health department, while they're doing a regular sanitation inspection, if they see something that looks like a lead hazard, they can also make a referral, and generally we will go out with them and do a full investigation. Now, since there's not, in that particular instances, those type of instances, there are no lead poisoned children, we cannot require remediation. And so in that particular case, that information is given over to the licensing agency, North Carolina Department of NCDCDEE, Department of Child Development and Early Education, and they will generally take over the enforcement, and they will tell the child care centers, give them a certain amount of time to do remediation, and then we will go back out, and the environmental health specialist and I will go out, and we will take clearance samples and show clear the child care, that they have met their clearance. But we don't have, if there's not a lead poisoned child, we cannot require remediation. And I think another part of the question is, have I ever had any daycares that have refused us entry to do a lead investigation? And every now and then I'll get someone who refuses us to come in, and normally, but that's very rare since I've been doing this since 1995. And normally that actually more occurs during just an inspection. Sometimes they just don't want to let us in. And we have a law called a summary disapproval, where we can go ahead and just send in a disapproval to the licensing agency. But normally, if we have a problem getting in, I don't think I've ever had a daycare in since 1995 that has told me that I couldn't come in and do a lead investigation. Unfortunately, sometimes I know they're not real happy that we're in there to do it, but luckily in this case, the child care had no lead hazards, so that worked out pretty well.
Wonderful. That would only be more advantageous to them to show that they were not implicated in this. So we have
Right.
another question back to the cinnamon. And it says, have you identified the cinnamon producers? And if so, is there any way to prosecute?
So yes, we have identified the cinnamon producers. Actually, the cinnamon producer is in Ecuador, and the Ecuadorian authorities did identify that person. And at this point, I am unaware that we have any ability to prosecute because it is in Ecuador.
Okay, I have another follow-up question for you that just came in as well. And it says, as this was shared, and this was a global incident and a food safety incident, what other countries and events are you aware of, and how much product was distributed?
I know that it was distributed. I mean, in a way, it's Puerto Rico is a territory, so, but it's not, you know, the continental states. And there was one other country that I'm aware of where the product was distributed, and they did have children with elevated levels of lead in their blood, but I cannot remember the name of it. But yes, I don't know that it went, you know, all over the world, but it did go to other countries. Yes.
We have time for one more question. And again, it's still on this vein of the recall, which case studies are fabulous. So glad you're putting together the report and the lessons learned. So how does it happen that you send out a recall and yet the product was still on the shelf? Is that hard to detect when the product keeps coming up on the shelf?
So one thing that I will say about that is we have requirements for firms to be able to conduct recalls. Our recalls at this point, most of them are voluntary. The firm would do a voluntary recall, and they would be responsible for providing certain information to us. And they would also be responsible for distributing, you know, the press to include, you know, pictures of the products, lot numbers, that kind of thing. I'm not officially speaking at this point, but I actually found product in a store locally here in North Carolina. My first day off after all this was going on, I had gone into a local Dollar Tree for craft supplies, because that's pretty much the only thing I'd buy at a Dollar Tree is craft supplies. And just because I had to, I looked and I found product on the shelf. So I went and grabbed somebody from the store, you know, asked for the manager, took him over, and I just pointed, and he knew it was recalled. He's like, that shouldn't be there. And he said he had taken it off the shelf and put it in the back of the store. So at some point, either they didn't mark the product properly to not restock it, or segregate it properly, or obviously they didn't throw it away or destroy it. And another employee put it back on the shelf when they saw it. They were all supposed to have a system in place where if somebody tried to purchase the product, their computer system would deny the purchase. But I saw actually that not working because they just would scan another flavor. So again, that was reported up, and that's something that we have to address with the firm, because it is the firm's responsibility to do that, and it's our responsibility to notify the public, which we did. And that's another reason why I think this was, in a way, really an example of a very good response, because our state partners went out to these stores multiple times to make that determination on whether product was still on the shelves or not. Normally, we would go out and do, recall effectiveness check once. We would, ask questions, we'd look on the shelves, we, fill out our forms, and that would be that. But that didn't this time. So we're trying to figure out, why or how. But this was an isolated incident to our knowledge.
Well, unfortunately, we are out of time today, and I would love to thank you all, Michelle, Alan, Perry. Your information is so interesting. And we do have some questions in the chat that we didn't get to, but we will send you those questions. And if you could give us an answer to those, we will post those to our attendees, as well as the recording of this webinar up on the NEHA website and our NEHA YouTube channel. And so to the attendees, thank you for taking time out of your business day to join us. And your feedback is very important to us. And we encourage you to fill out the short survey that you will receive at the end of this webinar. And it helps us here at NEHA to continue our mission, which is to build, sustain, and empower an effective environmental workforce. And again, to our panelists, thank you for keeping us safe, our children, our grandchildren safe. And with that, I wish you all a good rest of your day. So thank you.